And so this patient of mine had put off medical consult thinking that some form of dwarf has cast a spell on him. He says, nanuno. Hello, my name is Dr. Aye. I'm a Filipino dermatologist. In this video, we're going to talk about the nasty cousin of chickenpox, which is shingles. Many know and remember the misery of chickenpox, but many of us don't know a lot about shingles, as illustrated in that earlier slide we watched. I used to believe that if I never had chickenpox, I would never have shingles in my life. But I learned in DERMA residency this is not true. Listen to 10 myths and how quickly each one is debunked. At the end, if you can stomach it, take a look at the nastiest shingles rash I've ever seen in my entire career. We are going to debunk 10 myths, but the craziest myth of all is at the end, so hang tight. Myth number 1. Chickenpox and shingles is the same thing. No, they're caused by the same virus, but shingles and chickenpox are not the same illness. Chickenpox brings on hundreds of itchy blisters that heal in 5 to 7 days and usually affects children. Meanwhile, shingles rash may be fewer and grouped together in a dermatome and can last about a month. The blisters look similar because shingles is a reactivation of the same chickenpox virus. What happens is once you have chickenpox, the virus becomes dormant. That is, it sleeps, but it can reactivate years later and cause shingles. The difference is that shingles is localized to a certain area of the body only, while chickenpox can be generalized. Myth number 2. Shingles is rare and only affect old people. Again, not true. It affects a lot of people. About a third of all Americans will get it in their lifetimes. That's 1 million per year. Children, the elderly, those who have cancer or HIV, essentially anyone with weak immune system, are at an increased risk for developing shingles. However, before any shingles disease, one must have had a history of chickenpox before. Nagkabulutong ka na ba dati nung bata ka? Myth number 3. Shingles is not contagious. Shingles appear first as a red rash and then develop into a blister or a lesion with fluid inside. The rashes are commonly grouped together in a linear area like a stripe and most often found on the torso or the lower back. Now when the blisters pop, you have an open blister with fluid draining. The rash cannot pass on shingles, but they can spread the virus to someone who's never had it. That virus can cause chickenpox in a person and can lead to a later shingles outbreak. Myth number 4. Shingles can be gone in a few days. Sandali lang yan. When shingles start, it starts with symptoms like itching, pain at the rash site before the rash appears, fever, chills, headache, and swollen glands which may last for 2 to 4 weeks. Para ka talagang trangkaso muna. But listen to this very carefully. As much as 40% of people feel a burning, shooting pain for months or years after the rash has healed. This is called post-herpetic neuralgia, the lingering complication of shingles. Myth number 5. Stress has nothing to do with shingles. This is a wrong assumption. Stress can weaken the immune system, increasing the chance of a shingles outbreak. Another thing is that stress may also intensify pain during an episode. Myth number 6. Shingles doesn't involve the eye. This is a significant part for me as I am not only a dermatologist but I am also an ophthalmologist, so I see these kinds of cases in my practice. Shingles does occur in the eyes and affect vision, so be extra vigilant about symptoms around your eyes. Ocular shingles can lead to severe complications like glaucoma or even blindness. This is why it is important to be proactive about it. Myth number 7. You can't treat shingles. The truth is, if you take an antiviral medicine in the first 3 days after the rash appears, that may ease the pain and help you get rid of it sooner. The earlier you start, the better it works. Now, the medication may not make the rash disappear, but it should shorten and reduce your symptoms overall. As a doctor, I've given pain relievers to my patients. I can also give steroids and nerve vitamins like vitamin B complex to help. Myth number 8. You can't get shingles more than once. Many people don't know this. It's unlikely to get shingles again. but a new outbreak can occur in different body areas. So if you get a shingles vaccine, it may reduce the likelihood of future infections. On to the next myth, myth number 9. The painful rash is the biggest problem. Gravely mistaken, my dear. Shingles can lead to more than just rash and nerve pain. There could be other symptoms like skin infections, fever, headache, or stomach aches. There can also be muscle weakness, carrying problems, hearing loss, or pneumonia. In rare cases, it can lead to serious problems like, for example, an infection in the head involving the eyes, the ear, or the nose can lead to a stroke or meningitis. So this is why immediate consultation with the doctor is important. Magpatingin po kayo agad. Myth number 10. I've never had chickenpox before, so I will never have shingles. This is why this is wrong. People born after 1995 may not ever had chickenpox, but they may have gotten the chickenpox vaccine. And because immunity can wane as we age, they may still be able to get shingles later in life. All patients at risk must discuss the shingles vaccine with their provider. Remember this, vaccination doesn't guarantee immunity, but it can lower your risk of having shingles by over 90%. Okay, here we go. The myth of all myths. Shingles can be caused by a dwarf spell. In the Philippines, where I practice, patients sometimes relate a medical condition to a superstitious belief. And so this patient of mine had put off medical consult thinking that some form of dwarf has cast a spell on him. He says nanuno. And you know what he first did? He went around town trying to seek the help of a local herbolario or albolario in our language. It's a herb doctor or witch doctor. And so the delay in treatment has resulted into this massive breakout in his torso. I'm sorry, this is graphic. This is the biggest shingles I have seen during my 8 years of derma practice. It's a pity, but he went on for a week like that, and when he could bear the pain no longer, then he sought medical consult. So please take heed of this tip. If you notice rash, popping up with worsening blister pain, your skin may be beginning a shingles rash, so come to see the doctor. Consult at the clinic immediately because the earlier the treatment, the better the outcome. Okay, I hope you learned something today, and if you did, please give us some love by liking this video. Now that you know the essentials about shingles, consider talking to your doctor if you have any concerns or symptoms. Thanks very much for watching this video. Comments and questions are welcome in the comment section below. I have put up a similar video talking about the biggest ringworm I've ever seen in my derma career. See you there!